you. Oh, good to know. We bring you important topics that you want to see. And this month, of course, is Foundation Month. So it'd be very appropriate that our Tuesday talk is all about foundation. So with that, I'd like to turn the meeting over to Bob Wallace, our District Foundation Chair, to introduce our program and our speakers for tonight.
Thanks, Ron. It's great to be here. Great to see a lot of faces on the screen. There's more still coming in, but as Ron said, this is Rotary Foundation month in November, as always, and as I mentioned at a couple of weeks ago, that it's our money. We get to decide how to spend our money. So we've got two people and a few minutes from Jim later on, but two people who are going to talk to us about the Rotary Foundation and the projects and the benefits that we as Rotarians get from using our money for projects. The first one will be Bryn Stiles. Bryn is from our neighboring district to the north, 7010. And he's a past Rotary International Director and a past Rotary Foundation trustee, as well as currently the aides to our president of Rotary International, Shekhar. So without too much more, Bryn, go ahead and welcome to our meeting tonight. Thank you.
Thank you very much, Bob, and thanks for the invitation to speak tonight on a topic that is very near to me, our Rotary Foundation. And it's always a little nerve-wracking when you're in an audience when you have two past foundation chairs in the audience, Wolf and Bob. So it is great to be here. I'm not sure of the knowledge. I recognize a lot of faces, and it's great to see everyone, but I'm not sure of the knowledge level of everyone about the foundation. There could be some longer-term Rotarians who have some knowledge or a lot of knowledge, and then there may be some newer members who are just beginning to understand our foundation. I always say that learning about our foundation is a process, and I would encourage, you can't learn it all at once. It's a very vast topic, and I'd encourage you to continue to learn by attending seminars such as this, whatever the district is putting on, online, etc., or the Rotary Leadership Institute, where they have a great section on our Rotary Foundation. But I like to keep the foundation as simple as possible. And it's basically broken down into two parts. The programs of the foundation on the one hand, and then the funding required to do those programs. And our programs are diverse, as I think you know, and they now cover a wide range of humanitarian projects. The foundation, I think, as we know, was started in 1917, but the first official program wasn't until 1947, and that was as of international scholarships. And our programs have developed and grown since then. And many of our programs were the idea of either a Rotarian, one or two Rotarians, perhaps it was a Rotary Club or a Rotary District who initiated some project, and that became one of our programs. The Group Study Exchange, the former Group Study Exchange, is a perfect example of that. When two Rotary districts in, I believe, Denmark and New Zealand decided to exchange some professionals, and that developed over time into our Group Study Exchange. Probably the most familiar program to most Rotarians would be that of our grants. And you know, there's two types of grants: our global grants, which are done internationally. The thing I have to keep reminding Rotarians is that we are international. We always think of global grants being done elsewhere, doing a global grant in Africa, in India, South America. But if we get a partner, an international partner, we can do a global grant in our own communities with that partner and utilize the funds of our Rotary Foundation. And then, of course, the other type of grant is that of district grants. Historically, up until about 2010, 2013, Rotarians donated to the foundation, but they were always asking, well, how can we utilize some of those funds in our own area, in our own districts? And it was with the new program that started in 2013, it was the district grants, which allowed Rotarians to utilize those funds in their own communities through some parameters that were set. So first off, global grants. Before 2013, global grants were called matching grants, and they were usually smaller projects, and some of them quite small dollar value. We found that they weren't sustainable. There was no measurement of how effective they were, and there was an administration cost allocated to each grant. So the Rotary Foundation decided that we needed our global grants to be larger, stronger, and so we encourage clubs to do that, more sustainable projects. And that encouragement has worked, and we're now almost a victim of our own success. When clubs and districts do a project that meets the requirements of one of the 7 areas of focus, they can apply for matching funds, as you know, from our Rotary Foundation. And I'm not going to go into the matching formula. I'll leave that to others to describe that at a different time. But the results are incredible. So I did a little research. So since 2017, basically in 5 years, Rotary clubs and districts in Canada have done over 475 global grants. And the total value of those projects is over $40 million. I'm talking US dollars. But of that $40 million of the total project cost, over 1/3, or about $15 million, was funds that were derived from our Rotary Foundation. And your district, District 7070, has been no slouch in this area as well. Of those 475 grants that were done across Canada, 27 of those grants were from District 7070, and they had a total value of $2 million, over $2 million US. And of that, 650,000 was from our foundation supporting your projects. Just a couple of examples: the Rotary Club of Uxbridge got $69,000 to do a project for young mothers in Malawi, and the total value of that project was about $185,000. And then the Whitby Sunrise Club has just been approved for a project in Beirut, helping in the pediatric ward of a hospital. They're getting $83,000 from our foundation for a project of the value of about $360,000. That's the power of our foundation with respect to global grants. Peace centers. Peace centers is something that I'm very passionate about. I'm past chair of the Rotary Peace Centers, and Rotary Peace Centers develop leaders who then become catalysts for peace and development around the world. The Peace Centers were started in 2002 at 5 universities around the world. We now have 7 centers, peace centers around the world. 5 are providing a master's degree program, which is 2 years of a fully funded program for the participants, for the scholars. And then there are 2 what we call certificate program, and these have just developed into a 1-year, what we're calling a multifaceted program. You may have heard that the newest Peace Center opened just this past January, started with their first class at Makerere University in Kampala, Uganda. And as you know, sub-Saharan Africa has been one of the most volatile areas of the world. So since the inception of the Peace Centers in 2002, we now have over 1,400 graduates, alumni as we call them, working in 115 countries around the world. They work as leaders in both governmental and non-governmental agencies. They work in education and research, in law enforcement, they're in the military, they're in humanitarian groups, and they're with some of the world's largest NGOs. The Peace Center applications to become a scholar have increased 180% since 2015. And this year, we had over 850 applicants for about 125 spots, 45 master candidates moving forward, and 80 certificate candidates. And you may have heard the news that the most exciting news is that we are now in the process of selecting a site for a new Peace Center in Middle East, North Africa. And this is due to the generosity of one donor who is fully funding the opening of the center. a donor who believes in the power of our Rotary Foundation. Our Rotary Peace Centers program is recognized as one of the preeminent peace programs in the world. What would be a talk about polio, or with foundation without a talk about polio? And I'll defer to Bob on some of these comments. I'm going to start with what I consider the really big news, and I know that it hasn't really been published that much in Rotary. I think they're a little nervous. In January of 2021, there was one case each in Afghanistan and Pakistan. And since that time, there has been no new cases of the world polio virus in the world. That's almost 11 months of no polio. And I think, as you all know, we need to be 3 years, 36 months without a new polio case, a wild polio virus case in the world for an area to be considered polio free. We're almost 1/3 of the way there. There has not been a polio case, a wild polio virus case in the world since January of 21. In 1988, I think we know, or since 1988, we've immunized almost 3 billion children, and more than 19 million of those are now walking today who otherwise would have been afflicted and paralyzed by polio. Rotary itself has contributed over $2.2 billion to the global polio eradication efforts. And in Nigeria, and I think you know this as well, Nigeria was the last country in Africa to be recognized as being polio free. And the lead in Nigeria was Dr. Fungi Tutso, and he was recognized by Time magazine as one of the 100 most influential people in the world in 2020. We continue to immunize children around the world, 450 million children every year. So people ask about COVID and polio. And I think, as you know, that Rotarians are people of action, and that was displayed no better than with our response to COVID. As the world shut down, Rotary opened its resources in the response to polio, or to COVID. Even though the pandemic caught the world by surprise, at Rotary, our long-term commitment to disease eradication meant that we were well prepared to respond when it struck. Members have donated supplies. We've sourced, remember the acronym PPE? Who knew what PPE was 2 years ago? But we sourced personal protection equipment, supported hospital and health workers, and highlighted the efficacy of vaccines, encouraging people to get vaccinated. Canadian Rotarians rallied just a few months ago when India was being struck in a crisis with COVID and supplied ventilators to their hospital. Grant approvals for COVID projects were approved within 48 hours. Anyone who's done a global grant knows the time it takes to get approved. These grants were approved within 48 hours. Our staff worked long hours during the early stages of COVID. So far, over $46 million for global grants have been used in the fight against COVID-19. And because of our polio readiness, we were ready in the trenches. The infrastructure we already had in place developed to end polio is helping us counteract the coronavirus. Polio personnel have played a vital role against COVID-19 in almost 50 countries. 30,000 polio program staff have been deployed to help with the global response in building capacity, community engagement, in surveillance, disease surveillance, which is so important, and in communications. All of these programs I've mentioned empower Rotary members to continue to promote peace, fighting disease, providing clean water, saving mothers and children, supporting education, and growing our local economies all over the world. And as you know, we've now added the environment to our portfolio of areas of focus. This past year, 2021, ending in June, over $143 million was awarded for global grants around the world. And grants for polio eradication totaled almost $153 million. Through June the 30th of 2021, since our Rotary Foundation started doing its work, our Rotary Foundation has invested over $5.5 billion to the programs that have had lasting effect on our communities around the world. And then there's the second part. I said Rotary Foundation is two parts: the programs we do and the funding to do that. The funds required to do these programs. Personally, like most of you here, when I joined Rotary in 1986, I didn't suddenly decide to become a strong supporter of our foundation. I didn't even know what our foundation was. I believe that our relationship with our Rotary Foundation is a journey. And as Rotarians, we're all at different parts of that journey. When I first joined, I was told I had to contribute to our Rotary Foundation. And I didn't even know what that was. As I mentioned, it was probably due to peer pressure, but I donated and it was probably $50. But over the years, I learned more about our foundation and what it can do. And I started to contribute more. We now ask Rotarians to become sustaining members and donate a minimum of $100 per year. People should contribute to our foundation. In fact, they should contribute to any charity because they believe in the mission and the ability of that charity to carry out your own personal goals. And in fact, no one can ask or tell you how much is the right amount for you to give to support our foundation. Your journey with our foundation is personal. But as you learn more about the foundation and start to understand it, as you become involved in a grant project, as you fund a local project, your support increases. You do make the foundation one of your charities of choice and consciously decide to support it every year. Excuse me. Each year, some of you may decide to join the Paul Harris Society, where if you contribute $1,000 every year, you become a member of that society. You can reach the major donor level of $10,000 and then continue on your journey. Some may decide to start an endowment to support what is your passion within Rotary. And each year, only the interest of that endowment is used to support your area or areas of focus. Or if you are able, you become a member of the Arch Clump Society. But the important thing, and one of the things I find is that, and then you decide that you want your legacy as a Rotarian to continue after you have gone, and you leave a bequest to the foundation. That way, your journey with our foundation never ends. Rotary sets its goals for fundraising every year. And every year we always do much better than our goals. In 2021, just this past year, the generosity of Rotarians and supporters of the foundation were outstanding. And we raised over $441 million. Now this, I will be honest, this does include the $100 million match from the Bill and Melinda Gates Foundation towards polio. This year, because of COVID, the trustees weren't quite sure how donations would be, and the goal is slightly less. But I know that as Rotarians, we will exceed that goal. The total goal is $410 million. I think, as you know, there's a rating system for charities in the US called Charity Navigator, and they rate thousands upon thousands of charities. For the last 12 years, the Rotary Foundation has received its top ranking of 4-star. And LinkedIn, the networking site, rates the Rotary Foundation as one of the top 10 volunteer organizations in the world. These are difficult times, I will give you that. But I believe that the world needs Rotary now more than ever. We need Rotary, the world needs Rotary to help the most vulnerable. It needs Rotary to help bring an equitable distribution of resources around the world. And I believe that we as Rotarians need Rotary as a method, as a vehicle, so we can reach out across the globe and find a friend who we can help. And that, my friends, is done through our Rotary Foundation. So thank you very much. And Bob, I will leave it to you if there's questions or if we just move on. Thank you.
Thank you so much, Bryn. Great story about the Rotary Foundation and how our money is managed and used in very worthwhile projects. I don't see any questions. If anybody has any questions, put them in the chat, and between Charles and I will monitor it. But what I'd like to do, since there's no questions there, is move on to our second speaker tonight, and that's Dr. Charlotte Hunter. And Charlotte is a family physician with a special interest in HIV/AIDS care. She works at St. Michael's Hospital and with the academic family health team and Casey House. And she was a District 7070 Global Grant Scholarship recipient. And this is another way that the foundation dollars are put to use. So, and Charlotte's going to tell you about how this has impacted her life and her work in the medical field. So with that, Charlotte, are you available to continue?
Yes, hi, I'm here. Thank you so much for
Hi, Charlotte.
Hi, Bob. Thank you so much for having me join your meeting tonight. And it was great to hear from Bryn as well about all the other wonderful things that the foundation is doing, including a lot of things in the health sector. It sounds like you've all done an incredible amount of work during the pandemic. So hats off to you for that. So as Bob said, I'm just going to talk a little bit about my experience receiving the Global Grant Scholarship for last year and sort of what I did for my program and how I hope that'll enable me to do work in the future that I hope aligns with Rotary's values. Bob, is it okay if I share my screen for a few slides?
Yeah, let me do that for you, Charlotte. Okay, can you do that, Charles? I don't have that.
I seem to have the button, so I can try to.
So go ahead, Charlotte. Yes.
I should be able to do it. Yeah. Just give me 1 second.
Thanks, Charles and Charlotte.
We're seeing your screen now.
That's good. Perfect. Okay. As Bob mentioned, I was very fortunate to receive the Global Grant Scholarship for 2020-2021 for District 7070. And I'm just going to tell you a little bit about that experience this evening. So just a little bit about my background. So I did my undergraduate degree in human biology with a global health specialization at U of T. And that was where I first developed an interest in healthcare, and in particular working with vulnerable communities, both in Canada and internationally. I then went on to do medical school at Western and came back to Toronto for my family medicine residency training at St. Mike's Hospital, where I now work as a staff physician. And after my residency, I did an additional fellowship in HIV/AIDS primary care, so HIV/AIDS care delivered by family doctors. And then for some reason, I decided I wanted to do even more school. So that is where the next stage of my journey took off. So I decided I wanted to go back to do a master's degree in public health. And some of the reasons for that were to learn a bit more about what we call the social determinants of health. So things like poverty and poor housing and lack of education and gender and things that differentially impact people's health outcomes and their access to health care. Because particularly with the populations that I work with, I see how those factors can impact people's ability to take care of their health and to access health care. I wanted to also develop some practical skills in healthcare policy making, planning, financing, and valuation. These are things that I sort of picked up a little bit of just being in the healthcare sector, but not something we learn as formally in medical school. I also wanted to develop my research skills, and I wanted to learn more about providing healthcare internationally and in lower resource settings, both at home and abroad. So I decided to do a master's degree in public health, and after looking at a few programs, I landed on the one at the London School of Hygiene and Tropical Medicine, which is in London in the United Kingdom. This is a very old institution. It's considered one of the best public health schools in the world. And it's also a very international school. So there were lots of other Rotary scholars there and lots of students from other countries, which really enriches the program. And as well, the faculty are from all over the world, and a lot of them have experience doing humanitarian work and working with humanitarian organizations. And so in order to help assist me with taking time off from working and pursuing this degree, I applied for the Global Grant Scholarship. So the process of that was that I had reached out to the Rotary Club of Etobicoke, which is part of the city that I grew up in, to have them officially sponsor me. Then there's a written application and ultimately an interview process, which happened on Zoom because it was right kind of during the first year of the pandemic. For those of you who are less familiar with the Global Grant Scholarships, they are for postgraduate work, so a graduate degree program, either a master's degree or PhD, I believe, in one of the Rotary areas of focus. So they're listed here. I'm sure you're all familiar with them, but mine was disease prevention and treatment, which is, of course, most closely aligned with a public health degree. So I wanted to just kind of give you a sense of some of the things that I studied, just so you can kind of see how, from a practical perspective, a public health degree is related to my work, and also I think to a lot of the work that Rotary does around the world. So I thought it was a very practical master's program. It had a wide breadth, so you can see I learned things from health economics and how you sort of finance things like clinics and immunization programs, to research methods, the sort of more mathematical side of public health with epidemiology. And then at the bottom, I've listed some of the courses that I took that were sort of elective choices of mine that were really important to me. So I got to take a course particularly in epidemiology of infectious diseases. I picked that because with my interest in HIV, that's something I'm particularly passionate about. But I was also doing this program in the middle of an unprecedented global pandemic, as you all know. So it was incredible to be taught by some of the leading experts in COVID in the UK. People who were being interviewed on the BBC were sort of teaching me about infectious disease outbreak management. So that was pretty incredible. So I took something called social epidemiology, which looks at how factors like poverty and inequality, like the things I mentioned before, like housing and education and ethnicity, can kind of impact people's access to healthcare. And some more practical courses like healthcare evaluation. So I think Bryn was talking about, evaluating the grant projects that you all carry out. And in healthcare, that's important as well, to make sure that the programs and the treatments that you're offering are actually evidence-based and are leading to the outcomes that you hope that they are. And then the last course I've listed here, Conflict and Health, was just an incredible course I was able to take related to providing healthcare in humanitarian emergencies, natural disasters, and conflict zones. So that was really eye-opening for me. It was led by faculty members who had firsthand experience working with organizations like World Health Organization, Doctors Without Borders, Red Cross, and very practical teaching about how you, what you prioritize in the first week or first month after a natural disaster has occurred, and then how you over time transition that into more longer term development. So that was something that I haven't had as much exposure to working in Canada, and it was eye-opening for me. And while all of my studies were, in terms of the actual lectures, were online, unfortunately, during the pandemic, and I completed the first term studying from my house in Toronto, I did ultimately get to go to the UK, which I was very grateful for. So I've just included a few photos here. I hope you've all had a chance to visit the UK sometime in your life, or that you will down the road, but these are some of my favorite pictures. So I have the first one is of the Seven Sisters Chalk Cliffs. It's a hike along in Sussex and on the south coast of England. That was very beautiful. Then one of my favorite places to run along the Thames River in London. You can see the Millennium Bridge there and the St. Paul's Cathedral. And then the last photo is just me on the top of a mountain in Scotland where I got up to with a few friends and we did some hiking there. So even though I was only there in the end for about 4.5 months, it ended up being an incredible experience. And I was so grateful that I still got to go. So in terms of where I am today, so I just wrapped up the master's degree at the end of the summer, but I did come back in July and actually joined the practice at St. Mike's Hospital Family Health Team, which is where I did my training. And it's called an academic family health team because it's closely tied with the University of Toronto. And we do teaching for, we basically train the medical students and family medicine residents. And it has a real focus on caring for marginalized populations. And my practice in particular, I continue to have a special focus on caring for people living with HIV. And I think it was a good place for me to land after doing the master's degree because it has a lot of connection with getting involved with research and advocacy and global health work. A lot of my mentors in my workplace are very involved with broader projects outside of the clinic, and some of them are involved with international projects advancing family medicine internationally. As well, I continue to work at a place that's very dear to my heart called Casey House, which is a small 14-bed HIV hospital in Toronto that was founded in 1988 at the height of the AIDS pandemic and still serves that population and has grown a lot over the years. And it was the beginning of my journey in healthcare was tied to Casey House because I volunteered there throughout my whole undergraduate degree. And then I was able to come back there as a physician years later. So really, really interesting place if you ever want to check out their website and see about the work that they do as well. In terms of my sort of future career possibilities, I am just about 4 months into my practice, so I'm just trying to keep my head above water with that. But I do hope, the reason I did the master's degree was to get involved in things outside just of the clinic setting and also hopefully outside of Canada. So I do hope to continue to be involved with academic research. Right now I'm working on some projects looking at how the COVID pandemic has impacted the opioid crisis. I'd also potentially like to get involved as I advance through my career with policy making or consulting for international organizations, and how opportunities to get involved with the humanitarian medical field work and crisis response through organizations such as Rotary, if possible, but also organizations like the Red Cross or Doctors Without Borders. And I'd also really like to be involved with training healthcare workers in less developed settings and strengthening health systems internationally. So I feel that the degree I was able to do with the funds from Rotary Foundation has really strengthened my knowledge and skills in these areas, and has benefited me in terms of my career goals, but also I hope it will enable me to give back in a way that aligns with Rotary's values. And I'm just very grateful for to have been the scholarship recipient last year, and happy to answer any questions any of you have, or if you have any scholarship applicants down the road who need advice, I'm around and happy to talk more about it. So I will stop there, and I'm happy to answer any questions.
Okay, thanks, Charlotte. A great story about our foundation dollars in action and right at home here in Toronto. Have anybody got any questions for either Bryn or Charlotte? I haven't seen any in the chat room yet. Glad to hear from Charlotte, from a fellow Mustang graduate at Western. I was there many, many years ago. But
so Bob, I have one question for Charlotte. It's Virginia. Yeah. I just wondered if, Charlotte, have you thought of applying some of like your learnings and your skills also to our northern Indigenous communities?
Yeah, absolutely. I actually, before doing the master's, I had done some work up in Nunavut. So I spent a month and a half working in Iqaluit, working at the hospital up there and in the clinics. And absolutely. Like there's probably nowhere in Canada that I would call the sort of social determinants of health are more evident than with our Indigenous communities. I have a lot of Indigenous patients in my practice here in Toronto, but I would absolutely love to have the opportunity to work up in Northern Ontario or up in the territories again. Because it is very sad. Despite it being part of the Canadian healthcare system, there are still they're not as well resourced as the rest of the country, and as sounds like you may know that there's a lot of inequalities in terms of higher rates of mental health challenges and tuberculosis and all kinds of problems that are particularly prominent in those communities. And I absolutely would love to do some more work there.
Well, I know that there are some clubs that are working on being involved in things like that, but I also believe that it's an area where our district could make use of global grants and partner with other countries to be able to make some improvements there. So
there is a Rotary Club in Iqaluit in Nunavut. You may know that already, but there are Rotary clubs in the territories that you could partner with as well.
Charlotte, have you joined a Rotary Club yet?
I have not, but I'm supposed to be getting in touch with Kevin, who I know is on the call here about the district in Toronto. So I'm definitely on the market to look for the right club that's the right fit and in terms of the part of town where I live and things that I'd like to get involved with. But I'm definitely interested.
Well, the Rotary Club of Etobicoke.
Linda Ryder in Etobicoke, are you listening? I just said, Linda Ryder, are you listening from Etobicoke?
We welcome you. I know, Charlotte, and I should just tell everyone that we have just had a Peace Scholar accepted, Jyoti. So we're very excited, and Ian Lancaster's he worked with me, and Kevin worked with me with Charlotte. So it is just so exciting to see such great young people today. So but don't forget the Rotary Club of Etobicoke, Charlotte. Just in case, Kevin.
And that's where I grew up. So that's where
I know.
Neelam
Hi,
had
Charlotte.
his hand up.
Nilam here. Not a question, but just a comment. Thank you for taking me down the memory lane, because my daughter also went to the London School of Hygiene and Tropical Medicine. So seeing that logo, but the breakdown you gave over your curriculum, I think that was more than what she ever gave me. But listening to that, I think the tuition fee that I funded was well invested. So thank you for all the good work.
Thank you so much.
Thanks, Neelam.
I have a question for you. Is the program that you completed in England specific to medical professionals, or is it open to people of other backgrounds?
Yeah, so thank you for the question. So there were a lot of medical and other healthcare professionals. There were a lot of nurses in the program as well, but it's absolutely not restricted to healthcare professionals. There were lots of people who were just coming out of their undergraduate degree or had been working in the NGO sector or just coming from a completely different background. So absolutely, it was open to all.
Thanks, Charlotte. And I've got a couple of questions in the chat, and I'm Bryn and Dr. Bob, you can maybe answer this one. This is from Renee. On the news tonight, there was mentioned that there was a polio outbreak in Afghanistan. Can you, either of you, update the group on that?
Bob, I saw that and I just Googled it and I didn't see anything in Google, but Bob Scott may have maybe some inside information.
No, I haven't. That's the first I've heard.
Yeah.
Okay. Well,
What
thanks.
do they mean? Have you any idea what they mean by an outbreak?
Renee, can you add to that?
Is it an outbreak, or there was an item on the news that said there was an NID?
No, there was an outbreak. They said on the news there was an outbreak in Afghanistan on polio. So right away my ears perk up. And they were sending a health team there to do the vaccinations. And that's all I picked up, like, from the 6 o'clock news.
They hadn't, sorry.
They may be getting mixed up because there's a National Immunization Day going on. And it may well have been, for polio, of course, and it may well have been misinterpreted.
Okay.
Certainly, you're making my hair stand on end with that kind of news.
Yeah, I mind it. Charlotte, can you add anything about, you mentioned comment about COVID and the opioid crisis, the connection?
Yeah, so it's very sad. The people who work in that sector, like I see a lot of patients who have opioid dependence, and it's absolutely gotten worse throughout the pandemic. All kinds of reasons why. Part of it is the drug supply. So for whatever reason, the changing patterns of the drug trade around the world were interrupted in such a way that actually the sort of supply on the street in places like Canada is much more strong and toxic and more likely to lead to overdose deaths. Then there's just the interruption of healthcare services where people who were maybe a bit connected but getting some support for addiction were not able to access that as well during the pandemic, and particularly people who are living on the streets, don't have a cell phone, very hard to access any kind of virtual healthcare. People losing their housing, and then that kind of thing tends to make it really hard to stabilize in terms of when you're trying to get through a substance use disorder. And yeah, just I think I would say a big part of it is unfortunately the drug supply on the street that people are injecting is becoming more and more toxic and leading to more overdose deaths. So just worse problem and harder to address it at the same time. It's a bit of a nightmare, and it's still kind of clawing our way out of it, unfortunately.
Neelam also has a comment.
I have a question for Bryn. You mentioned that last year, because of COVID, the global grant, the funding went kind of largely towards that. Now, post-COVID this year, has there been a shift back to sort of normal circumstances, or do you have any sense yet?
Thanks, Neelam. I don't think they have a real sense yet. I haven't heard the crisis, I won't say crisis, but the pressure that was on staff like there was last year for global grants. So I don't know that there's not the COVID grants that there were like last year, but our global grants generally are increasing incredible. The numbers every year go higher and higher. They're larger, so they're taking more funds. And that's why the trustees are making decisions on how to make sure there's still funds for all the grants, reducing the funding 80% from 100, not matching cash contributions, etc. So the global grants are very popular. The one thing, and somebody I think mentioned it just earlier, is I always encourage clubs and districts to do some global grants locally. And somebody just mentioned about doing something in our northern communities using global grants, which would be a perfect example.
And along with that, we talked about needing international partners, and in our combined zone, we have lots of international clubs as part of our zone that would be, I'm sure, welcoming to do projects with us. So it looks like Virginia's husband had a look at the news, and it was to do with the NID. Peter has asked, global grants take a long time to approve. Why? I don't know whether that's still the case or not. Bryn, can you add to that?
Yeah, from what I hear, there is still a time period. One of the things that we're encouraging is we're trying to, I don't know if you're aware of some of the support groups for these called the cadre. The cadre is a group of Rotarians who have expertise either in areas of focus or in grant writing. And we're encouraging people who are writing grants to get in touch with the cadre to ensure that when you submit the grant, it's as complete as it can possibly be. They understand what's required, and that will expedite the grant approval process considerably. the time period, and the staff had these statistics just a few years ago. And I'm not saying that it's part of 7070 or Canada, but when there's an issue with the grant, ensure that you're partnering, the club or district you're partnering with are responsive. If there's a question that the staff ask and it goes back to maybe the host country, the delay isn't getting a response sometimes from those countries. The staff are ready to work on it, but then the delay is that the Rotarians, wherever the grant is being done, don't always respond in a timely manner.
Thanks, Bryn. And we've got a great resource in our district with Lars, who helps you out with grants. So if you have any questions, Lars is a great person. There's more stuff in the chat that everybody's getting, and it has to do with a World Health Organization polio vaccine campaign with the Taliban backing was what the news was about. So that's all good news. I just want to add one quick comment. This is for everybody's interest, but Charlotte in particular. I was doing some work with some high school students not too long ago, and we were talking about healthcare and the fact that every one of us on the screen tonight has that magic green card in their wallet that gives you complete free access to healthcare in Ontario. And there was a study done by a guy at the Hamilton Spectator who looked at the Golden Horseshoe area, and it is not the case where people have equal access to healthcare. Jobs, employment, housing, all that have a huge impact on whether they have adequate healthcare. It was an amazing study that I found because everybody has that green card in their pocket. Okay, one more thing before we turn it back over to Ron to talk about next month's Jim Luted.
Thanks for giving me a couple of minutes this evening. For those of you that do not know me, I am Jim Luted, a past district governor from the Rotary year 2016-17, and I'm also a member of the district's Rotary Foundation Committee. So as a member of this committee, my responsibilities are the endowment fund and major gifts. I'm also a member of the Rotary Foundation's Major Gifts Initiative Committee, with my focus being community economic development. So this is a 3-year term that started July 1st of this year. So, but quickly on this committee, I am one of 4 Canadian Rotarians on this global committee, and the only Canadian focused on community economic development. And our Rotary Foundation trustee is Dean Rohrs, who, as you know, was our zone's past RI director. So it's quite a large committee. As I said, it is global. But and because last month was Community Economic Development Month, I was fortunate to have several articles about this topic posted on TRF Canada's website, and then one each at the RI's Service and Action blog, and then at the Rotary Action Group for Community Economic Development's website. So if you have a few minutes and wish to read the articles, I will welcome any feedback you may have. But you've already heard from Dr. Charlotte Hunter and past Rotary International Director Bryn Stiles about the Rotary Foundation. I especially like one comment Bryn made, the power of the foundation when speaking of global grants. So tonight I want to mention a couple of items on my area of responsibilities that support the power of foundation. So how about a great gift idea for the holidays? Establish your own legacy through the Rotary Foundation that your family and generations to come can witness in action. You can personalize your legacy with a gift today to see it in action or as part of your estate plan. An endowed fund can be established through a stock gift, allowing you to save on your 2021 taxes. And who doesn't want to save on taxes? Or you can provide a pledge, which can be gifted in installments of either 2 or 3 years. So this provides for the tax advantage to be spread out and allows for the major donor gift recognition to be delivered upon the first gift made versus waiting until the full amount has been donated. I know we have don't have much time, so if you want more information on the endowment fund or major gifts, please reach out to me at my email address, which is jvlrotary@gmail.com, which I'll also post on the chat along with my phone number. Thanks, Bob.
Thanks, Jim. Thanks, Jim. So before I turn it over to Ron, I want to thank Bryn and Charlotte for taking time to be with us tonight and give us a really good couple of stories about our foundation dollars at work and the benefits that we all can derive from the foundation and projects and district grants and global grants. So again, Bryn and Charlotte, thank you so much for joining us tonight. Over to you, Ron.
Thanks, Bob. On behalf of all the Rotarians of District 7070, a very special thank you to past RI Director Bryn Stiles and Dr. Charlotte Hunter, our Rotary Scholar. One of the things that we do for our speakers in our Tuesday talks, and I know this will be near and dear to both your hearts, is we do make a $200 donation in your name to the Rotary Foundation, which we will do this month. So thank you again. And Bryn, I was actually listening to every word you said, and I have a new graphic to be able to explain to our Rotarians about the money coming in, the recognition they get, and the projects that it goes to. And thank you for sharing that. And thank you, Dr. Charlotte Hunter. We look forward to having you join us in one of our Rotary clubs in our district. Now, one of my jobs that past District Governor Beth gave me is to let you know about next month. And next month, we've got Dr. Bob Scott, our very own Dr. Bob Scott. And he's here with us tonight, who's going to do who's going to work with Linda Kay, past president of the Rotary Club of Coburg and a well-known broadcaster in that area of the world, who's going to take us through End Polio Now, a one-on-one conversation with past Rotary International Vice President, Chair Emeritus of the Polio Campaign, Dr. Bob Scott. So please go to the events calendar, make sure you register for the event, and let's have a big showing for Dr. Bob Scott and Linda Kay next month. December is Disease Prevention Month. So very fitting for that Rotary logo, but also very fitting for everything that we need to do for polio. We're that close. So thanks everybody for being here tonight. Thank you again, past RI Director Bryn Stiles. Thank you, Dr. Charlotte Hunter. Thank you, Bob Wallace. Great Tuesday talk.
Thanks everyone, and enjoy the rainy week that's out there, and everybody stay well.
Thank you for having me.
Thanks, Charlotte.
Thanks, everyone. It was great.
Thanks, everyone. Good night.
Thanks, Brent, for the information.
Thank you, everyone.
Good meeting.